Okay guys, I am here with Dr. Sine Dufour, and today we're going to talk about SPD, which is a question I get asked all the time. Hendrix over there, PS, in case you're like, what is that noise? We're talking about Symphysis Pubis Dysfunction, which is a lot of the times this pain that we feel. I call it lightning crotch in your groin and your pubic bone. It's very common during pregnancy and it can last up to a year after or more. So what do we need to know about SPD today?
Okay, so yes, it is a very common experience or symptom to have this lightning crotch pain, this pain right at the part of the body called the symphysis pubis. It's essentially a piece of sort of cartilage, fiber cartilage that connects the two sides of the pelvic bone. So it's actually quite a strong structure. But it's also a part of the body where so many different things attach to. So when we get pregnant with hormone levels changing, with some of the strain and stretching of some of the ligaments that come into that area, the round ligament is one of those, that part of the body can become very sensitive. Now, historically it was thought that because it was sensitive, it must be separating.
Right.
You must be busting this fiber cartilage. And so women have been told that yes, this front part of your pelvis is separating.
Yeah.
It's a dysfunction. And that can be really quite frightening to think that and then think you have to birth a baby through, a pelvis that doesn't have good integrity. But we actually know that that isn't true. So we know that...
So nothing is separating. Your pubic bone isn't ripping apart?
No. The pelvis is actually one of the strongest, most robust parts of our entire body. So for you to bust through that fiber cartilage, you would need a trauma. You would need something really strong to happen. However, yes, we have this common experience of this pain here. So there are things we can do, because one of the things that will exacerbate that sensation is when the pelvic tissues, the pelvic floor, or any of the hip muscles are becoming more tight or protective, right? As the pregnancy marches on, and also depending on how you're feeling about the birth.
Right.
Some people can feel a lot of fear and anxiety. The pelvic floor is a very innately protective muscle. So as it starts to get tighter, we have less oxygen, we have a lot of tension on those mechanoreceptors, so that can make it more sensitive. Also, as our round ligament stretches out to accommodate baby, you're going to have some of that sensitivity. So what do we want to do? Well, we first want to understand that our pelvis is not separating. It really is now a no-no to even use that term, actually.
There you go. So pubic symphysis dysfunction, or SPD, is really, what is it?
It really is encapsulated in the umbrella term pregnancy-related pelvic girdle pain.
PGP?
Yes. So that can be any pain at the symphysis pubis, which is the joint at the front, or the sacroiliac joints at the back. Any pain in that region is now more correctly...
So here,
yes.
Or these two
areas there.
Right there.
Exactly.
Okay. 1, 2, 3.
Any pain there, really more correctly now, should be called pregnancy-related pelvic girdle pain. And then people need to understand what to do about it. So understanding a bit about what it's all about can help. That can reduce the fear right away. But there's also some very gentle, we call it novel movement, and movement that really encourages symmetry through the pelvis, that can actually make these structures less sensitive because it takes that extra strain off the structures. So I have a little sequence I developed that Nikki is going to demonstrate for me here. Okay, so I'm going to kind of just come sit down a little closer to her, but I don't want to block her out. Okay, so Nikki, you're going to come into butterfly, right? Okay, so we see that Nikki is in butterfly pose here. From this position, you actually first want to just kind of have your brain speaking to your pelvic floor to kind of just let it go, right? Because we usually don't take that time to kind of think about what's happening in this protective, anxious muscle, right? So you're going to let that go. Once you feel some of that tension go, the sides of your feet that are making contact with that mat, you're going to, as you exhale, push your feet down into the mat.
I'm going to inch this way so people can see. So pushing this part of my feet down.
You got it. So we're doing the effort on the exhale, right? And then she's going to inhale, let all that go, and she'll repeat that 2 more times. Good. Perfect. After that, she's gonna bring her knees up. One of the things that often happens when a woman has a sensitive pelvis when she's pregnant is she starts getting into the habit of anticipating she's gonna have pain anytime she moves, and then she starts getting into a habit of bracing. And so we want to teach the brain not to do that because that makes things worse. So Nikki, when you lifted your knees up, usually I would tell someone to, as they inhale, just float the knees up. Make sure they're not anticipating any pain, not bracing. Just kind of float up. Now you're at that position. Now you're going to gently, as you exhale, you're going to squeeze your knees together. So she's going to exhale, squeeze her knees. What often people with pregnancy-related pelvic girdle pain will do is they'll clench their pelvis when they squeeze their knees.
Like this.
Yeah, they'll kind of clench the whole system. We don't want that. We want them to teach their knees to kiss together with intention and keep this soft, right? And then you're going to inhale, let that go, and you'll do that 2 more times. Good. And one last time.
So I'm not Kegeling.
No, you are not Kegeling on this. A lot of these exercises we could actually turn into pelvic floor exercises but the purpose of this is all about ease, developing symmetry and length. So we're not Kegeling. Good question though. And last one. Good. Okay, so her last move, she's going to set up now for bridge. So she's going to line up her heels kind of in line with her sitting bones. She's going to be hip distance apart. Yeah, we got it perfect there. And now again, she's going to move with her breath without a Kegel, right? Exhale, she's going to push into her heels and she'll gently lift up, and then inhale, she'll come down. And you'll do that 3 times.
Feeling my glutes.
Yes, you'll feel it in your glutes. You don't want to feel it in your back, right? You want the glutes doing the work, which is why you want to push through your heels. Good, that was the 3rd one. And now she's going to come back down into butterfly. So normally what we would see here with someone who had an upregulated sensitive pelvis is at the beginning we might have one hip like this, and then after 1 round of this, they're symmetrical and they can right away feel better.
That's awesome.
So that's it.
Oh,
so
that
that's
is-
your SPD here, but we're not calling it SPD. Pregnancy-related pelvic girdle pain.
So helpful, and it's actually really nice to actually do that. So thank you.
Yes,
You're awesome.
very good. You're most welcome.